As we are getting older, many of us experience joint pain and heart problems. Some people experience stabbing or pressing pains behind the sternum, shortness of breath, rhythm disruption, and heart palpitations. In this regard, each of us is faced with the problem of choosing a medication to relieve pain and inflammation in the joints, which, on the one hand, well relieves the pain syndrome, and on the other hand, doesn't have a harmful effect on the heart. And since there is nothing better than non-steroidal anti-inflammatory drugs to relieve pain and inflammation in the joints to date, we have to choose pills from this group of medications. I know what you're going to ask. Alright, doc, what medications can we choose? I will start with Voltaren. This medication is quite good. It easily copes with joint pain, but it can provoke heart attacks and vascular damage, so it is not recommended for people with cardiovascular insufficiency, hypertension, and coronary heart disease. So I would say that currently Voltaren doesn't meet the high safety requirements. Let's look at Nimesulide. In practice, I have been convinced more than once of its effectiveness. It easily copes with pain in the lower back. Besides, it is relatively safe in terms of the development of gastrointestinal bleeding. For acute pain relief in a short-term course of treatment, the advantage of Nimesulide is indisputable. But in terms of long-term therapy, the prospect is very uncertain. In addition to liver and kidney problems, Nimesulide is also contraindicated in severe cardiovascular insufficiency, against the background of coronary heart disease, hypertension, and a number of other cardiovascular diseases. Nowadays, many rheumatologists like to prescribe so-called Coxib, in particular the drug called Arcoxia, which active ingredient is Ataricoxib. Its efficiency is generally comparable to Voltaren, although in practice Arcoxia more often than others causes unwanted problems related to arterial hypertension and cardiovascular failure. From my point of view, this medication is most suitable for relieving pain and inflammation in the joints of young people. For elderly patients, I advise to take Arcoxia in minimal effective doses and for as short period as possible. Pay special attention to this point. Among the entire group of non-steroidal anti-inflammatory medications, the most effective and safe is Meloxicam, whose main advantage is good tolerance. In my memory, there is not a single case of heart attack in patients who have been taking Meloxicam for a long time. By the way, this medication has another very important advantage. Unlike others, it doesn't interact adversely with low doses of aspirin while not detracting from its antithrombotic potential. This is a very important aspect, since most patients suffering from heart and vascular disease must take aspirin for life. So, if your joints hurt and heart is bothering you, I recommend you to take Meloxicam. As practice shows, it is effective and relatively safe. But of course, never forget to consult your doctor. Use my advice and be healthy, dear friends. As always yours, Natalia.